Good evening, everybody. I hope you all had a good day today. And I, Dr. Rucha Mavadia, moderator of this webinar, heartily welcome you all. This is the 1761st day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today's our guest and speaker is Professor Dr. B.D. Patel, sir, who is MD Homeopath and also postgraduate in Rehabilitation Technics, Mumbai. He is a former principal at Government Homeopathic Medical College and Hospital at Bangalore and Chandigarh also. He is a former director and dean at VM Homeopathic Medical College and Hospital, Salem, Tamil Nadu. He has more than 50 years of teaching and medical practice experience. He runs two clinics in Bangalore itself. He is also a member of advisory committee in Ayush. He has trained many students in RYLA programs. He is a speaker on spiritual subjects also. And one very interesting thing about Sir is that he can speak more than 15 languages, and few of them are Hindi, Urdu, Kannada, Telugu, Marathi, Gujarati, Tamil, Malayalam, Punjabi, Marwadi, Bhojpuri, Bengali, English, and Sanskrit as well. Sir has recently received Adhyatma Ratna from NTR 100 Birthday Celebration Committee. Sir has received many other awards for excellent service in homeopathy by Research Society of India. Sir has also received Dr. Honeyman Memorial National Award and Living Legend Award by Homeo Friends Gorakhpur. Uh, Sir has been awarded as Lifetime Achievement by Dr. William Swabe, India. Now, Sir has dedicated life for treating patients and study of Vedas, Upanishads, and right interpretation of Upanishads in the service of entire humanity, giving discourses in many organizations, temple, Rotary, colleges, and youth associations. And in this webinar, Sir is going to talk on gastric disorders and homeopathy. So I heartily welcome you, sir, for IFPH webinar. And we have 50 minutes for the talk and last 5 to 10 minutes for discussion at the end. So over to you, sir.
From my side, it is okay.
Everything. Now it is okay, sir. You can start.
Okay, now you are able to listen me.
Yeah, we are able to listen.
डॉक्टर रुचा जी बहुत बहुत धन्यवाद. आप कहाँ से हो?
सर मैं गुजरात से हूँ.
अरे तमे गुजू छो. अरे કેટલો સારો લોબા. સારો લાગે. अच्छा, now see, she told me 50 minutes and already she has taken 7 minutes. Now what will I do? Okay, right. In your study we'll talk on that. Friends, I don't know what made Dr. Dhanesh ji to request me to speak on gastric troubles and homeopathy. It is such a common complaint. Everybody has been treating so many cases of this problem. Without that, we can't live. No doctor can survive. But still, anyhow, I have tried to make something. And before we actually go into the cases, I would like something about let us know what exactly is food, what exactly is anna, what we call is anna. Anna is food. Let us not compare English and Indian languages, because English can never ever come nearer the Indian languages, and especially the Sanskrit. Okay, anyhow, we will take up that. Can I share my PPT, madam?
Yes, sir. Yes, visible, sir.
It is visible, fine.
Yes, sir.
And am I audible also?
Yes, sir. Perfect.
Okay, right. Friends, gastric disorders and homeopathy by me. Annam brahmeti vejanat. That means food is a misnomer in English, but anyhow we'll use that word. Food is Brahman. This itself is your life. This is said in Taittiriya Upanishad, Anandavalli, 2nd chapter and 2nd shloka. Annanyeva khalu pranani pravrittiriti shrutihi. What does it mean? It means that the activity of living beings is indeed for the sake of food. Everybody strives only for food, nothing else beyond that. And other things, they come up after that. Annam brahmed vijanat annat bhavati bhutani annena jatani jivanti prajnas bhi samvishanti. What does it mean? It means food is not merely physical sustenance. It is a manifestation of Brahman, means the creator. All beings emerge from food, are sustained by it throughout life, and eventually return to it. What a wonderful statement which has been given by this Vedic literature. We hardly think on these lines. We just think you take put some food in the mouth and keep on working. That is not the way. Anyhow, we'll see that. It is indeed for the sake of food that all beings act. And yet one could ask, is there any more to a job than just feeding the body? For some, work becomes a canvas to express one's dharma, a way to contribute, grow, or even attain a sense of purpose beyond mere subsistence. Thinkers from Gita to Maslow have wrestled with this gradient from survival to self-actualization. Now, I'm playing a small video. This is in local language because in Bangalore they speak this language. But see, today you take up anywhere in India, any language they speak, 50% is English or 75% is English and little bit is the local language. So this will be also like that. Try to get her features, the way she is talking, and English words are there which will describe her condition.
ಒಂದ್ ವಾರದಿಂದ ಎಷ್ಟು ಪರವಾಗಿಲ್ಲ ಚಿನ್ ಕಡಿಮೆ ಆಗುತ್ತೆ ಅದೊಂದು 3 days ಇಂದ ಗಂಧೆಗಳು ಕಾಣಿಸ್ತದೆ ಲೈಟ್ ಆಗಿ
ಇದಕ್ಕೆ ಮುಂಚೆ ನೀವು ಇಲ್ಲಿ ನಮ್ಮಲ್ಲಿ ಫಸ್ಟ್ ಟೈಮ್ ಯಾಕೆ ಬಂದಿದ್ರಿ
ಫಸ್ಟ್ ಟೈಮ್ ಬಂದಿದ್ದು ನನಗೆ ಫುಡ್ ಅಲರ್ಜಿ ಫುಡ್ ಸೆನ್ಸಿಟಿವಿಟಿ ಫುಡ್ ಅಲರ್ಜಿ ಅಂತ ಇತ್ತು ನನಗೆ ಮಾರ್ಚ್ ಫಸ್ಟ್ ವೀಕ್ ಅಲ್ಲಿ ಸ್ಟಾರ್ಟ್ ಆಗಿತ್ತು ಫಸ್ಟ್ ನಾನು ಹೋದಾಗ ಫುಡ್ ಪಾಯ್ಸನ್ ಆಗಿದೆ ಅದರಿಂದ ಲೂಸ್ ಆಗಿದೆ ಸ್ಪೊರ್ಲಾಕ್ ಅನ್ನೋ ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಂಡಿದ್ದೆ ಅದರಿಂದ ನಿಮಗೆ ರಿಯಾಕ್ಷನ್ ಆಗಿದೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಇಮಿಡಿಯೇಟ್ಲಿ ಹಾಸ್ಪಿಟಲೈಸ್ ಆಗಿತ್ತು ಅವಾಗ ಹಿಚ್ಚಿಂಗ್ ಇತ್ತು ಸಿವಿಯರ್ ಡಿಹೈಡ್ರೇಷನ್ ಆಗಿತ್ತು ಅನ್ಕಾನ್ಶಿಯಸ್ ಆಗಿದೆ 5 to 6 times ಲೂಸ್ ಮೋಷನ್ ಒಂದು 8 times ಆಗಿತ್ತು ಅದು ಫಸ್ಟ್ ಅಡಿಕ್ಟ್ ಆಗಿತ್ತು ಅದಾದ್ಮೇಲೆ ರಿಕವರಿ ಆಯ್ತು 1 month ಆರಾಮಾಗಿ ಇದ್ದೆ ನಾರ್ಮಲ್ ಆಗಿ ಎಲ್ಲ ಫುಡ್ ತಗೋತಾ ಇದ್ದೆ ಡೆಲಿವರಿ ಎಲ್ಲ ಚೆನ್ನಾಗಿತ್ತು ಎಕ್ಸಾಕ್ಟ್ಲಿ 1 month ಆದ್ಮೇಲೆ ಮತ್ತೆ ರಿಪೀಟ್ ಆಯ್ತು ನಾನು ಅವತ್ತು ಹೊರಗಡೆ ನಾನ್ ವೆಜ್ ತಿಂದಿದ್ದೆ ಎಕ್ಸ್ಪೈರ್ಲಿ ಮತ್ತೆ ಸೇಮ್ ಎಲ್ಲ ಸಿಂಪ್ಟಮ್ಸ್ ರಿಪೀಟ್ ಆಯ್ತು ಲೂಸ್ ಮೋಷನ್ ಹಿಚ್ಚಿಂಗ್ ಲೋವರ್ ಅಬ್ಡಾಮಿನಲ್ ಪೇನ್ ಅನ್ಕಾನ್ಶಿಯಸ್ ಆಗಿರ್ಲಿಲ್ಲ ಮತ್ತೆ ಅದಕ್ಕೂ ಮತ್ತೆ ಹಾಸ್ಪಿಟಲೈಸ್ಡ್ ಆದ್ರೆ ಮತ್ತೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಯ್ತು ಮತ್ತೆ 1 ವಾರಕ್ಕೆ ಮತ್ತೆ ಲೂಸ್ ಸ್ಟೂಲ್ಸ್ ರಿಪೀಟ್ ಆಯ್ತು ಲೂಸ್ ಸ್ಟೂಲ್ಸ್ ಹಿಚ್ಚಿಂಗ್ ಎವ್ರಿ ಟೈಮ್ ಇಮಿಡಿಯೇಟ್ಲಿ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ ಲೂಸ್ ಸ್ಟೂಲ್ಸ್ ಆದ ತಕ್ಷಣ ಏನೇ ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಂಡು ರಿಯಾಕ್ಷನ್ ಆಗಿ ಹಿಚ್ಚಿಂಗ್ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ ಲೋವರ್ ಅಬ್ಡಾಮಿನಲ್ ಪೇನ್ ಆಗುತ್ತೆ 3rd time ಅನ್ಕಾನ್ಶಿಯಸ್ ಆಗಿಲ್ಲ ಅವಾಗಿಂದ ನಾರ್ಮಲ್ ಸ್ಟೇಜ್ ಮತ್ತೆ ಬರಲೇ ಇಲ್ಲ ಹೊರಗಡೆ ಫುಡ್ ಕಂಪ್ಲೀಟ್ ಅವಾಯ್ಡ್ ಮಾಡಿದೆ ಹೊರಗಡೆ ನೀರು ಕಂಪ್ಲೀಟ್ ಅವಾಯ್ಡ್ ಮಾಡಿದೆ ಆಮೇಲೆ ಫ್ಯಾಮಿಲಿ ಡಾಕ್ಟರ್ ಒಂದೊಂದೇ ಡಯಾಗ್ನೋಸ್ ಮಾಡಕ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರು ನಂದು 3 ವರ್ಷದಿಂದ ಎಲೆಕ್ಟ್ರಿಕ್ ಶಾಕ್ ಆಗಿತ್ತು ಹಾಗಾಗಿ ಒಂದು ಬ್ರೈನ್ MRI ಫಸ್ಟ್ ಮಾಡಿಸಿದ್ರು ಅದು ನಾರ್ಮಲ್ ಬಂತು BP ವೇರಿಯೇಷನ್ಸ್ ಫ್ಲಕ್ಚುಯೇಷನ್ಸ್ ಇತ್ತು ಲೋ ಆಗ್ತಿತ್ತು ಹೈ ಆಗ್ತಿತ್ತು ಅಂತ ಅದನ್ನ ಮಾಡಿದ್ರು ಅದು ನಾರ್ಮಲ್ ಬಂತು ಅದಾದ್ಮೇಲೆ ಈಗ ನನಗೆ ಹಿಚ್ಚಿಂಗ್ ಹಾಗೆ ಇತ್ತು ಬಾಡಿಯಲ್ಲಿ ಲೈಟ್ ಆಗಿ ಬರ್ನಿಂಗ್ ಫೀಲ್ ಇತ್ತು ಅದಕ್ಕೆ ಟ್ಯೂಮರ್ ರಿಲೇಟೆಡ್ ಏನೋ ಇರ್ಬೋದು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು 1 by 1 ಅವಾಗ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರು ಎಂಡೋಸ್ಕೋಪಿ ಮಾಡಿದ್ರು ಎಂಡೋಸ್ಕೋಪಿ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ನಾರ್ಮಲ್ ಬಂತು ಆದ್ರೆ ಎಂಡೋಸ್ಕೋಪಿ ಸ್ಯಾಂಪಲ್ ತಗೊಳ್ತಾರಲ್ಲ ಬಯೋಪ್ಸಿಯಲ್ಲಿ ಯು ಹ್ಯಾವ್ ಟು ಅವಾಯ್ಡ್ ಗ್ಲೂಟನ್ ಕಂಟೆಂಟ್ ಫುಡ್ಸ್ ಅಂತ ಹೇಳಿದ್ರು ಗ್ಲೂಟನ್ ಕಂಟೆಂಟ್ ಫ್ರೀ ಡಯಟ್ ಫಾಲೋ ಮಾಡ್ಬೇಕಂದ್ರು ಸರಿ ಓಕೆ ಆಯ್ತು ಎಂಡೋಸ್ಕೋಪಿ ನಾರ್ಮಲ್ ಆಯ್ತು ಬಟ್ ನನ್ಗೆ ಅಷ್ಟರೊಳಗೆ ಎಲ್ಲಾ ಫುಡ್ ತಗೊಳಕ್ ಆಗ್ತಾ ಇರ್ಲಿಲ್ಲ ಲಿಮಿಟೆಡ್ ರೈಸ್ ಐಟಮ್ ತಗೋತಾ ಇದ್ದೆ ಬೇಳೆ ತಗೋತಿದ್ದೆ ತರಕಾರಿಯಲ್ಲಿ ಬೀನ್ಸ್ ಮೂಲಂಗಿ ಕ್ಯಾರೆಟ್ ಬೀಟ್ರೂಟ್ ಇಷ್ಟು ಮಾತ್ರ ಬೇರೆ ಯಾವ್ದು ತಗೊಳಕ್ ಆಗ್ತಾ ಇರಲಿಲ್ಲ ಅವಾಗ ಎಂಡೋಕ್ರೈನಾಲಜಿಸ್ಟ್ ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಕ್ ಹೇಳಿದ್ರು ಬಿಕಾಸ್ ಆಫ್ ಹಾರ್ಮೋನ್ಸ್ ವೇರಿಯೇಷನ್ ಸ್ಟ್ರೆಸ್ ಎಲ್ಲ ಇದ್ದಂಗೆ ಆಗುತ್ತೆ ಅಂತ ಮಣಿಪಾಲಲ್ಲಿ ಹೋದೆ ಅವ್ರದ್ದೇ ರೆಫರೆನ್ಸ್ ಅಲ್ಲಿ ಕಾರ್ಟಿಸಾಲ್ ಟೆಸ್ಟ್ ಮಾಡಿದ್ರು, ಅದು ನಾರ್ಮಲ್ ಬಂತು. ನಮ್ ಕಡೆಯಿಂದ ಎಲ್ಲ ನಾರ್ಮಲ್ ಆಗಿದೆ ಅಂತ ಹೇಳಿದ್ರು. ಪ್ರೋಬಯೋಟಿಕ್ ಕೊಟ್ರು. ಪ್ರೋಬಯೋಟಿಕ್ ತಗೊಂಡೆ ನಾನು 15 days. ಅದ್ರ ಜೊತೆಗೆ ಮೊಸರು ಬೆಳೆಸ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದೆ. ಬೇರೆ ಫುಡ್ ಎಲ್ಲ ತಿನ್ನಕ್ ಆಗ್ತಿಲ್ಲ, ಮೊಸರು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದೆ, ನೀರು ಎಲ್ಲ ಕುಡಿತಾ ಇದ್ದೆ. ಅದಾದ್ಮೇಲೆ ನನ್ಗೆ 3 months ಬ್ಯಾಕ್ ಮೊಸರನ್ನ 2 ದಿನ ಮೊಸರನ್ನ ಹೊರಗಡೆ ತಿಂದಿದ್ದೆ. ಕೇಕ್ ತಿಂದಿದ್ದೆ ನಾನು ಬರ್ತಡೇದು. ನೆಕ್ಸ್ಟ್ ಡೇ ಅನ್ಈಸಿ ಫೀಲ್ ಆಯ್ತು, ತುಂಬಾ ಅನ್ಈಸಿ ಫೀಲ್ ಆಯ್ತು. ಅವತ್ತು ಸ್ವಲ್ಪ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಫೀಲ್ ಇತ್ತು ಅಂತ ನಾನೇ ನೈಟ್ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಂಡು ಊಟ ಮಾಡಿ ಪ್ರೋಬ್ಯಾಟಿಕ್ ತಗೊಂಡೆ. ಅಷ್ಟಾದ್ರೂ ಮತ್ತೆ ಎಲ್ಲ ಸಿಂಟಮ್ಸ್ ರಿಪೀಟ್ ಆಯ್ತು. ವಾಮಿಟ್ ಆಯ್ತು, ಲೋರ್ ಅಬ್ಡೋಮಿನಲ್ ಪೇನ್ ಆಯ್ತು, ಸಿವಿಯರ್ ಡಿಹೈಡ್ರೇಷನ್ ಆಗಿತ್ತು. ಮತ್ತೆ ಹಾಸ್ಪಿಟಲೈಸ್ ಆದೆ. ಆವಾಗ ಡಾಕ್ಟ್ರು ಮತ್ತೆ ಅಡ್ಮಿಟ್ ಆಗ್ಬೇಕಾದ್ರೆ ನಂಗೆ ಸಾಕ ಹೋಗಿದ್ದು ಅಡ್ಮಿಷನ್, ಬೇಡ ಅಂತ ಹೇಳಿದೆ. ಅದ್ ಒಂದ್ಸಲ ಹಂಗಾಗಿದ ತಕ್ಷಣ ಅದ್ ರಿಕವರಿ ಆಗಕ್ಕೆ ನನಗೆ 1 month ಹಿಡಿತಾ ಇತ್ತು. ಆ ಸುಸ್ತು, ಆ ಆಂಗ್ಸೈಟಿ ಫೀಲ್, ಆ ಫ್ರಸ್ಟ್ರೇಷನ್ ಎಲ್ಲ ಸೇರಿ ಅವಾಗ ಮತ್ತೆ ಸಿಟಿ ಸ್ಕ್ಯಾನ್ ಮಾಡೋಣ ಅಂತ ಹೇಳಿದ್ರು. ಮತ್ತೆ ಮಣಿಪಾಲ್ದು ರೆಫರೆನ್ಸ್ ಕೊಟ್ರು, ಸೀನಿಯರ್ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟ್ರಾಲಜಿಸ್ಟ್ ಅಂತ. ಸಿಟಿ ಸ್ಕ್ಯಾನ್ ಮಾಡಿದ್ರು, ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಗಳೆಲ್ಲ ಮಾಡಿದ್ರು, ಎಲ್ಲ ನಾರ್ಮಲ್ ಬಂತು. ಇನ್ ಬಿಟ್ವೀನ್ ಅಲ್ಲಿ ಸಿಟಿ ಸ್ಕ್ಯಾನ್ ಆದ್ಮೇಲೆ ಫುಡ್ ಅಲರ್ಜಿಸ್ಟ್ ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ಅಂತ ಮಣಿಪಾಲ್ ಅಲ್ಲಿ ಹೇಳಿದ್ರು. ಫುಡ್ ಅಲರ್ಜಿಸ್ಟ್ ಮತ್ತೆ ಡ್ರಗ್ ಅಲರ್ಜಿಸ್ಟ್ ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ರು. ಫುಡ್ ಅಲರ್ಜಿಸ್ಟ್, ಡ್ರಗ್ ಅಲರ್ಜಿಸ್ಟ್ ಹೇಳಿದ್ರು. ನಂಗೆ ಡ್ರಗ್ ಅಲರ್ಜಿಸ್ಟ್ ಸ್ಪೊರ್ಲಾಕ್ಟಿನ್ ನಿಮ್ಗೆ ರಿಯಾಕ್ಷನ್ ಆಗಿದೆ, ದೀಸ್ ಆಲ್ ಮೇ ಬಿ ಬಿಕಾಸ್ ಆಫ್ ಸ್ಟ್ರೆಸ್ ಅಂತ. ಅಲ್ಲ ಇದು ಅಂದ್ರೆ ಮತ್ತೆ ಫುಡ್ ಅಲರ್ಜಿಸ್ಟ್ ಅಂತ ಬಂದ್ರೆ ಫುಡ್ ಅಲರ್ಜಿ ಟೆಸ್ಟ್ ಮಾಡಿದ್ರು, ಎಲ್ಲ ಯಾವ್ದಕ್ಕೂ ಫುಡ್ ಅಲರ್ಜಿ ಇಲ್ಲ ಅಂತ ಗೊತ್ತಾಯ್ತು. ಅವರು ಮತ್ತೆ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟ್ರಾಲಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗಕ್ಕೆ ಹೇಳಿದ್ರು. ಲಾಸ್ಟ್ ಒಂದೇ ಉಳ್ಕೊಂಡಿದ್ದು ಕೊಲೊನೋಸ್ಕೋಪಿ ಇರೋದು, ಅದನ್ನ ಮಾಡಿಸಿ. ಕೊಲೊನೋಸ್ಕೋಪಿನ ಮಾಡಿಸಾಯ್ತು. ಕೊಲೊನೋಸ್ಕೋಪಿಯಲ್ಲೂ 2 ಬಯೋಪ್ಸಿ ತಗೊಂಡ್ರು, ಅದು ನಾರ್ಮಲ್ ಬಂತು. ಅಗೇನ್ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟ್ರಾಲಜಿಸ್ಟ್ ಹೇಳಿದ್ರು ನಮ್ ಕಡೆಯಿಂದ ಎಲ್ಲ ನಾರ್ಮಲ್ ಆಗಿದೆ, ಫುಡ್ ಅಲರ್ಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗಿ ಅಂತ. ಮತ್ತೆ ಫುಡ್ ಅಲರ್ಜಿಸ್ಟ್ ಹತ್ರ ಬಂದ್ರೆ ಅವ್ರು ಹೇಳಿದ್ರು ಇದ್ರ ಬಿಹೈಂಡ್ ಏನು ಟೆಸ್ಟ್ ಇಲ್ಲ, ನಿಮ್ಗೆ ಇದೆಲ್ಲ ನಾರ್ಮಲ್ ಬಂದಿದೆ. ನೀವು ಫುಡ್ ನಿಮ್ದು ಲೈಫ್ ಸ್ಟೈಲ್ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಚೇಂಜ್ ಮಾಡ್ಬೇಕು, ನಿಮ್ ನಿದ್ದೆಯಿಂದ ಹಿಡಿದು ಊಟದಿಂದ ಹಿಡಿದು ಸ್ಟ್ರೆಸ್ ಲೆವೆಲ್ ಎಲ್ಲ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಕೋಬೇಕು ಅಂತ ಹೇಳಿ ಮುಂಬೈದು ಒಂದು ಡಾಕ್ಟರ್ ರೆಫರೆನ್ಸ್ ಕೊಟ್ಟರು. ಅವ್ರನ್ನ ಆನ್ಲೈನ್ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ಅಂತ. ಅಷ್ಟರೊಳಗೆ ನನಗೆ ಸಾಕ ಹೋಗಿತ್ತು. ಮತ್ತೆ ಫುಡ್ ಅವ್ರು ಲಾಸ್ಟ್ ಅಲ್ಲಿ ಹೇಳಿದ್ರು, ನೀವು ಫುಡ್ ಎಲಿಮಿನೇಷನ್ ಡಯಟ್ ಮಾಡ್ಬೇಕು. ಈಗ ಯಾವ್ದು ನಿಮಗೆ ಆಗ್ತಾ ಇದೆ ಆಗ್ತಾ ಇಲ್ಲ ಒಂದೊಂದಾಗಿ.
Now, this is what she has been telling. Certain things we have been able to understand. And anyhow, I'll give the case. That lady is so-and-so. Her occupation is documentation in High Court. Food poisoning 6 months back by taking some food in hotel resulted in loose motions. This is what all she said. I'm just putting it up. Itching and rash all over the body by taking that sporolac drug. Diagnosed as IBS. Ultimately, anger to the extent of throwing things. She gets very easily angry and through. Known case of PCOD also. Using Thyronorm 50 mg and hypertensive drugs. She has been put on hypertensive drugs. Highly scared of lizard. History of electric shock due to old geyser, and she was admitted to hospital. And most of the problems started after that, like low BP, etc. This is what she said. Sporolac tablet was given, which caused allergic reaction, rashes. She was dehydrated and she became unconscious and was admitted to hospital. The treatment caused hypertension, for which she was prescribed again some drug, allopathic medicine. For 1 month, she was all right. She had again the attack after eating non-veg from a hotel. All symptoms repeated, loose motions, lower abdomen pain, and itching, so again hospitalized. She became unconscious after 5 to 6 times. A lot of investigations were done, asked her to avoid gluten content food. After that, many items were banned. She could only take rice, beans, radish, beetroot, and curds. Otherwise, no other food she was able to tolerate. After 3 months, she had curd rice and some little birthday cake outside. The next day, the problem started: vomiting, lower abdomen pain, severe dehydration, and admitted to hospital. Many tests were conducted. They were all normal and was prescribed probiotics. After every attack, I take 1 month to become normal. This is what she said: tiredness, anxiety, no interest work, all those things. Along with this, I have breathing problem, which I have not mentioned earlier. Then I changed the doctor. He prescribed anti-allergic tablets with antidepressant drugs. After some time, I had the attack. Again, I had the attack. Then I came to you with the reference of my friend. This was 10/8/24. We gave a dose of sulfur, 1 m. This video, what we have taken, is on 24/8/24. That is after 15, almost 2 weeks. She is much better. Video taken. She doesn't want to depend on anyone. She doesn't want to be bedridden. This is what she told me. Now, once in a way, she is getting urticaria, but less severe. Advised to stop the BP tablets. I advised her to stop the BP tablets. One more thing I have not told you about this lady is, this lady is married and she doesn't go well with her husband, and she is on the verge of getting divorced. On next month, much better, using silica tea for BP. If she didn't stop, she's still using that. We gave rubrum. Next month, stopped thyroid medicines. Again, no medicine, only rubrum. On November, she said, "Sir, I'm having too much of anxiety and thoughts. I'm not able to control myself. Please help me." We gave rescue 30. 14/12, next month, anxiety is less. She's becoming anxious but trying to control. She feels she's better compared to earlier. Again, rubrum. 1st January, started eating all vegetables slowly, no problem. She is more relaxed. Allergic tendency also reduced. Rubrum. Much more relaxed, placebo. 22/5, just last month, earlier, she was very choosy with vegetables and other food items. She has stopped so many things. Now she is able to eat and digest them. Let us observe how she spoke in the first video and the last video. Now, this video, I request her to speak in English, and she spoke in English.
Your good name?
My name is Yashoda, 34 years old. I came here for severe gut issues and skin allergies 6 months back. I was more anxious. I was not able to eat most of the foods. Like I can eat only 2-3 vegetables. That's it. I was on high depression. I was on hypertension. I was very weak also, mentally and physically. After these 5-6 months, I'm seeing much improvement, like physically and mentally also, especially from last 10 days. My food intake is increasing, like I'm able to eat more vegetables and more fruits. I can make my mind peaceful. Now I'm getting what was happening, what I was going through. Now I have a clarity, like what the negativities I should push away. Like I have a problem. I feel I have problem with people. Like if they taunt me, I directly take it personally. I was not aware of I should ignore, but I'm learning to ignore the things.
You're learning of your own or on somebody's advice?
From the doctor advice. 99% is because of the doctor. Yes, sir. I'm very thankful, very thankful. Very thankful.
God bless you, my dear.
Thank you so much, sir. I'm very happy now. I'm doing dhyana. I'm waking up early. I'm waking with a smile.
Oh, that's good.
I'm praying 2 minutes. I'm seeing the sky. I'm waking up before the sunrise. I saw the moon. Actually, I was very happy by seeing that. I'm reading people. I'm happy. I'm interacting with more people, but I should control my anger. That's the only problem I think I have right now. I'm not worrying about the future. I'm happy.
So nice.
Comparing to previous months, I am observing drastic changes.
Now you have seen this, friends. You observed the face and what she was speaking, how she was speaking, and now how she is. Now this is what homeopathy can do for all our problems. Let us see that. This is the basic gastric problem. Common symptoms are bloating, acidity, indigestion, and gas, constipation, diarrhea. These are the common symptoms which people come with. Importance of addressing gastric health, which can prevent chronic gastric disorders, because chronic gastric disorders can make their life hell. Like that, any disease can make life hell, but gastric is more important because we are living because of the stomach. We are living because of the food. पेट जो पापी पेट के लिए काम करता है वही करता है और दूसरा कुछ काम नहीं करते हैं. Now, causes of gastric problems, which we all know, but just a repetition. Number one, poor diet, junk food, oily, spicy meals, etc. Stress and anxiety, that you have seen now. Irregular meal timings, that also is the sedentary lifestyle. And overuse of antibiotics or NSAIDs. Now, I'll tell you, friends, we are all in the medical field. We know whenever you go to any allopathic doctor for any problem, they prescribe the required medicines plus one antacid. Do you know, do we all realize how antacid itself causes a lot of problems? That we must be careful and we should advise our patients. Now, types of gastric issues, what can be? One is acid reflux, GERD. One is gastritis. One is irritable bowel syndrome. Just now we have seen the case. Then constipation, flatulence, and peptic ulcers. So the common things which we face day to day. Now, common homeopathic remedies, everybody knows: carbohydrate, lycopodium, arsenicol, colocynth, and purslane. If we master these drugs, 50 to 60% of all the cases can be handled with these drugs. I've just given those symptoms, but that is not that. You need to study the drug carefully and prescribe that. We will take up some more cases. In case is Ramchandra, owner of an industrial unit manufacturing polythene bags. Predominantly of complaints predominantly of gastric symptoms, diagnosed as peptic ulcer. Pain in chest and abdomen, shifting time. Insomnia due to pain. My disease cannot be cured. This is what is strong impression. Patient is not able to give any other modification even on repeated questioning. He is on regular H2 receptors, antagonists, antacids, also been given. Anti-Helicobacter pylori drugs are also prescribed. Aversion to sweets. Fear of heart disease, fear that he may become mad, which is already there. Easily loses temper, hits whoever is in front. Past history, earlier used to have regular evening rise of temperature, appetite normal, thirst normal. Family history, diabetes and tuberculosis. Taken homeo treatment in Mumbai and Bangalore. Miasmatic diagnosis, what it was, tubercular. Treatment plan, the physical symptoms are very vague. We do not have much to prescribe, and at the same time, we have strong mental symptoms. Hence, the prescription must be based on the available mental symptoms. We prescribed him Lilium tick, 10 mg. How many of you are shocked by the prescription? I don't know. Patient is more jovial and feels much lighter, and gastric symptoms have reduced. Placebo. Next month, no return of symptoms, stopped allopathic drugs. Persistently feeling better, no more flatulence. Advised to stop medicines, but at the same time asked to follow strict bland diet, no smoking and drinking alcohol. Lilium tick was prescribed considering the following rubrics: fear of heart ailment, fear of becoming mad, pain on falling asleep, anger, irascibility, and irritability. Pain on falling asleep was taken as an eliminating symptom. The case was worked out on Kent's repertory. And this is what here it is. You can see first is calcarea, next is Lilium tick, I think so. Yeah. Next one is Lilium tick. So we prescribed Lilium tick 10 m, just 3 packets, and everything was followed with the placebo. Conclusion, very few of us are aware that Lilium tick is a violent remedy. They can hurt others when irritated. The repertorization was done with Kent's repertory. Generally, Lilium tick is thought only in female complaints, but here it has cured peptic ulcers based on mental symptoms. So, this proves unprejudiced observer. This is another case. Her name is Meera Ramakrishnan. Irritable bowel syndrome. She was 57 years when she came to us in the beginning. Homemaker, diagnosed as IBS. Watery stools with a mucus which exhausts her. Indigestion since childhood. Loose motions in general, aggravated between 9 a.m. to 1 p.m. Ayurvedic drugs increased her problems. Very anxious about her problem. Buzzing and sound in left ear. This is what he told me. Did not get along with stepmother. In 1974, she had to face sister-in-law who was schizophrenic. Just by seeing her, she used to get frightened, and that might have triggered the condition. Easily gets frightened. Introvert, doesn't mix up with the people easily. Sensitive, gets upset over small things or incidences. Her father couldn't devote time towards her as he was a minister and a professor. Very busy all the time. Brooding, religious, fastidious, wants always the company of somebody. Now the husband is also not able to devote time towards her. This is strong feeling which she expressed to us. Dreams of she and her father involved in a murder, and police is about to catch them. Anxious at any given appointment. Desires open air. Loves the sweets, milk, sour things, especially pickles. Extreme debility and prostration. Ear infection, left eardrum perforated. Family history, mother had some neurological problem and died with that disease. Mother died at the age of 9 when this lady was 9 years, the mother died. Couldn't get along with the stepmother. She was partial towards her. She has 2 children. Used some antidepressants. Frequently changes doctors and prefers homeopathic medicines. Taken many homeopathic medicines from different doctors. With Dr. Sudha, she is for the last 1 year, my neighbor and who worked under me as a lecturer. On 17/7/3, 2003, we gave her tuberculum 200 dose. After 15 days, she feels the medicine gave her instant relief. She is much better, stools better and better formed, frequency 1 or 2, very less mucus, appetite has come back, dryness of mouth is also much less. We gave placebo. After 1 more week, 2 more weeks, discharge from the ear started again, a good sign. Feeling lots of flatulence, otherwise fine. She went to Delhi and ate everything she liked, puris, jalebi, paneer, but she did not have any problem. The discharge from the ear is persisting, but only half a drop of pus once in 3 days. No odor, nothing. Gained 1 kg of weight Again, we gave placebo. Next month, she came. She is fine. No much problem. Now, let us all think why tuberculin was prescribed. This is for all of the members to think over, and we'll discuss in the next session. Now, this is another case. 27 years age, software engineer, Bangalore. First pregnancy, 3 months, third month, very violent vomiting. Admitted to hospital. Drips and other treatments for 3 days was given. Vomiting slightly reduced, but the gynecologist was worried as it may cause abortion. She was apprehensive. So reluctantly, they approached us. The presenting symptoms were nausea throughout the day, nausea aggravated by sight of food and drinks, or drinks means water or any liquid, or even the mentioning of the food, she used to get nausea. Every smell increased the nausea. Tongue is very clear. Highly irritable, highly anxious. So, as usual, as I prescribed, I also prescribed Ipecac 30. No change. Ipecac 200. No change. Colchicum, arsenic, and other medicines also have not helped her. She was in the nursing home and I visited her there as she could not move due to weakness. On repeated questioning, the attendant gave the following information. In spite of nausea, I forcibly give the food. She will be better for 2 to 3 hours, and again the nausea starts. Secondly, when I take her out for walking in the park nearby, she will be walking. At that time, there is no problem. And the moment she comes back to hospital, after half an hour or so, nausea and vomiting starts. Now, all of you think what medicines could be given. And you can put it in your chat box also. What we can think generally. We gave Sepia 1M in 1 dose was given. After that, no looking back. Gradually, the vomiting and nausea came down. We monitored the complete pregnancy in coordination with the family gynecologist. Normal delivery without much problem. So friends, this is the third case. This is the fourth one. Siddharth, 1 year. Known case of milk intolerance for 5 months. Diarrhea after mother's milk intolerable, stools sometimes watery, sometimes pasty and yellowish or clay color, but never hard. Variability of the color and consistency of stools. Appetite good, eats well, but not gaining weight. Frequent urination with a moderate quantity. No family history of similar type of complaints. Pregnancy was normal and delivery was also normal. No tensions to the mother. Dominant miasm is Sora. Just think what we can give. We give Pulsatilla repeated doses. Absolutely no change. On further interrogation, mother informed that the child strains while passing stools. Gave Albumin. Improving, number of stools have come down. Passing only 1 stool per day. Able to digest mother's milk. Stools normal in consistency. No recurrence of symptoms. Conclusion, Albumin was prescribed on the basis of soft stool passed with great straining. Just 1 symptom. And earlier we gave Pulsatilla 30, but now here we give Albumin 10. All of you think why. Now, food passing through stomach, diet and lifestyle support. Home cooked food is easy to digest food. Avoid triggers like caffeine, alcohol, spicy food. Regular meals, proper hydration, Stress management, yoga and meditation must be done. Basilinum often recommended for digestive issues linked to stress. Enterococcinum, this may be helpful for gut issues caused by stress or anxiety. Bovis, that is Bacillus bovis, a remedy that might help restore balance in the gut in case of digestive disturbances. Work on these drugs indicate, because I'll tell you, many of us, we keep on prescribing routine medicines. We never go beyond that what it is. Now, in the cases I presented, I never prescribed the routine medicines what everybody prescribes for gastric complaints, like Nux vomica, Pulsatilla, Lycopodium, nothing we prescribed. And the results were only with the list of the medicines which are not generally prescribed. How many of us really think of Lilium taking gastric problems? So like this, these medicines, because those who are very busy practice, seeing a lot of patients, they must be well versed with these few drugs, which can help us in many complaints. Now the best food, South Indian, North Indian food is the best one. Generally we say in Hindi, खाना खाया जाता है, भोजन किया जाता है, and आहार लिया जाता है. युक्त आहार विहारस्य युक्त चेष्टस्य कर्मसु युक्त स्वप्नावबोधस्य योगो भवति दुःखः. This is Bhagavad Gita shares wonderful statement. He who is regulated in his habits of eating, sleeping, recreation and work can mitigate all material pains by practicing the yoga system. Not gym, but only. And nowadays there is a wrong notion in medical people and others also. For everything, do walking. Bas walking karte raho, walking karte raho. Walking is an auxiliary one, not the entire cure for everything. Yoga is one which can really regulate your mind, body, thinking, anger, everything it can control if you follow the proper Ashtanga Yoga. Please advise our patients, even the doctors who are attending this can practice this, should practice that yoga, Ashtanga Yoga. Don't learn yoga in English. Yoga should be learned only in Indian language. It has its own benefit. Now, this is what it is. Even I also do this at this age, Shirsasana Yoga. Now, there is a wrong notion. I don't have proteins. I don't have B12. So you eat non-veg. Who's told you that? Absolutely no. We are on the medical field. Bodybuilding with vegetarian food and without gymnasium. This is the best proof. He could lift the mountain also. Conclusion. Based on totality of symptoms, this is how we prescribe. Patient's physical, emotional, mental state modalities we must follow. Homeopathy offers personalized and safe relief for gastric problems. Treats the root cause, not just the symptoms, as we all know. Effective when combined with good lifestyle habits. Please enjoy this. Everybody is conscious nowadays. The stomach is dissolved. and he's checking up. Now, this is what the Western food has made us so conscious. That small child is also conscious of his stomach and he's doing exercise. So why not we do? Why not we start doing yoga and restricting our diet properly and not taking unwanted things, many things. Many of the doctors who are attending this also, they eat pizzas, they eat burgers, they eat cakes, they eat so many things which are not needed. At least eat what is found in India. Don't eat anything that is outside food. It has their own things are there, and that's how we are putting on weight, and so many people are facing trouble. We must guide them. More than this, especially the food in the night should be eaten 3 hours before sleep. I told this to one of my patient to eat. He says, sir, I eat food at 9 o'clock and sleep at 12 o'clock. That is the worst habit. Sleep before 9:30 or before 10 maximum. Get up before 5. This is the healthy way of living, and body clock should not be disturbed. It will come up with so many problems. With this, I stop my talking, and we have sufficient time for all people to ask questions, discuss, and so many things. Yes, sir. I think some more slides are left over. There's also, we'll show it. That's it. Okay, this is what we have done it. Okay, this we have done. This was seen. Okay, now this is only these slides. Please, you can make note down of my number and my email ID. You can send me questions. You can send me any comments. You can send me anything what you want. And you can ask me any question except finance question, and that will be answered. Thank you, friends. And let us go. This house is open for questions and discussions and suggestions. Yes, Dr. Ruchaji.
Yes, sir. Very nice presentation, sir. Yes.
તમે સારું લાગ્યો?
Yes, sir. બહુ સારું લાગ્યું, sir.
સારું.
Yeah. I have one question, sir.
Yes.
Since you have treated this many gastric disorder cases,
Hmm.
what kind of food as vegetarian we should take to avoid, such a type of gastric interest in?
Specific. There's a very good question.
Yes, sir.
Gujarati food is the best, except the non-vegetarian. Dhokla khao apne, dal bhat khao ne, rotli khao. You can take that sabji. Any sabji is good because, most important part is you should eat seasonal vegetables and seasonal fruits. People every time they keep on eating paneer. Never ever eat paneer from outside. This is a very strong thing which I want to tell everyone. कभी भी पनीर मार्केट से खरीद के मत खाया करो. If you want to eat anything, paneer pakoda, paneer bhaji, or whatever it is, make paneer at home with the milk. Because I have so many videos which show so much of adulteration is happening in paneer. They are putting up palm oil. They are putting, before painting on the wall, they put a patti which is tasteless. They add that. And so many things. I have a video from Haryana. Every day they 20 tons of paneer to Delhi. If I tell you on this issue, the entire milk, if it is taken from India, all over India milk, and it is converted to paneer, that is not sufficient for Uttar Pradesh alone. Imagine now, every hotel, every fellow, whether he knows or not, paneer khayenge, paneer sabji khayenge. Please do not do this. Go to YouTube and keep on putting that paneer adulteration. You'll get a lot of videos which are original, which are not fake. So never ever use paneer. Paneer yahan khana hai, ghar pe bana khao. Dal roti garam khao. Another habit is those software fellows, they prepare food, keep it for 3 days in the fridge and eat it. Never ever do that. The proper time of eating food is the moment you prepare food, within 3 hours, it has to be over. It has to be, eat within 3 hours food. Sabji, some bach gaya, thoda rakh diya, theek hai. But otherwise, don't make it a habit to keep on eating 3 days earlier cooked food today. Don't do that. Anything else, madam? And drink water. Drink water only after 1.5 to 2 hours after meals. Before meals, you want to drink, you can drink water. Once you start, finish it, wait for 2 hours minimum, then drink whatever amount you want. And lukewarm water. I was really shocked when I came to Bangalore. Everybody is drinking warm water. मैंने कहा यार कोई पानी गर्म पीता है यार, ठंडा पानी पीना चाहिए. We are used to the thanda pani. But now when I see, medically we see, lukewarm water is one of the best drinks you take, and it dissolves, it digests, it helps, and so many other things it is beneficial. So these are the few things I want to say. Take it. And the most important part is, eat only when you are hungry. Don't eat if you are not hungry. Don't eat. 2 बजे खाना है, 3 बजे खाना, जैसे भी हो, भूख लगे तो खाओ. Otherwise, it's going to harm lot the body. Yes, ma'am. Any more questions? Yes, Dr. Chaji.
Sir, we have a question in chat box.
Ah,
Someone is asking about diet for diabetic patient.
yeah. Diet for diabetic patient is first diet, whatever I told, eat when you are hungry. Number 2, don't eat at least 2 morsels less. अगर आपने 4 चपाती खाना है तो 3.5 खाओ. And then immediately after taking food, don't take rest. 10-15 minutes minimum you walk. Number 3, you know what all to avoid. Non-veg, too much sweets. I need not tell you that, all are doctors. But one thing is, keep your mind very, 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 very calm and happy. If husband like me is there, shouts at wife, no problem. Wife shouts at husband, no problem. Because problem will be you have the problem, not other person. So be calm, because keep your mind calm, sit straight, do proper yoga. अरे भैया नमस्कार, प्रणाम प्रणाम प्रणाम, कैसे हो?
प्रणाम कर लाला जी.
प्रणाम राम प्रसाद जी. आपकी पोती है नोती है?
नतनी है.
अच्छा अच्छा
हाँ.
अच्छा. इसलिए इतनी अच्छी है, बहुत अच्छी है. और आपसे बहुत प्रेम करती है.
मम्मी आयुष मंत्रालय में है.
अरे मम्मी को मत कहा करो, माँ कहा करो यार. ये मम्मी का शब्द
अच्छा. हेलो सर. थैंक यू डॉक्टर रुचा and heartful congratulations, Dr. B.D. Patel.
Coming back to food.
Very thanks.
Right. And more vegetables. And you can do one thing. In weekly, there are 6 days. Let us take 6 days. 3 days you take millets, जिसको हम कहते हैं श्री धान्य. हिंदी में श्री धान्य कहते हैं. तो एक दिन ज्वार ले लो, एक दिन बाजरा ले लो, एक दिन गेहूं भी ले सकते हो, और 2 दिन सप्ताह में अंकुरित वस्तु खाओ, which are sprouted things, like there are sprouted dals are there. You can take 2 days in a week. Maintain this diet, do regular yoga, do regular walking, sleep before 10, and then accept the family history as there. It is genetic. You can avoid many things, and sleep time is more important. Sleep by 9:30 or 10 o'clock. अभी ये program होते मैं सो जाऊंगा, ठीक है? And then get up by 5 or 4:35, whatever time, and then spend minimum time on reels, seeing reels in mobile. Earlier we used to sit talk. घूमने आते थे, भाई चलो यार टहलने चलेंगे, let us go for an evening walk. There is no evening walk now. Everybody wants program on what you call WhatsApp. सर Zoom में करेंगे सर, Zoom में करेंगे सर, मिलेंगे नहीं सर, we will not meet. We want to do on everything on Zoom. When you sit for hours together, how your pancreas will be stimulated, and there are specific yogasanas to stimulate pancreas. Navasana. Okay, Murdandasana, Baddhakonasana. There are so many asanas which, and if you go to any yoga master, you can ask him, sir, I have diabetes. He will specifically do all those things. Anything else, sir? Anything else, my Dr. Ruchaji? Bijo kai chhe? Prashna?
Sir, we have one more question in chat box only.
Hmm.
Can diabetic patient eat mango?
Why not?
Question.
Definitely you should eat mango, but reduce the other part. 4 chapati की बजाय 3 chapati खाओ, आम खाओ. Okay, definitely. Seasonal fruits are much better. You avoid one smoking. Cigarette पीना बंद कर दो. एक सिगरेट 2 सिगरेट कम करो. 2-4 पेग डालते हो ना, वो पेग को निकाल दो. पेग डाल सकते हो पानी के साथ, only पानी, not with alcohol. All those things are there. Mango eat, banana eat, everything you can eat. अंगूर भी खा सकते हो जो डायरेक्ट शुगर है, और घी भी खा सकते हो, और देसी घी अच्छा खाना चाहिए, और गाय का घी. और ये नहीं कि मार्केट से गाय का घी खरीदोगे, देयर इज नो गाय इन दैट, और पता नहीं क्या क्या मिला के दे. अच्छा जो रिलायबल गाय का घी है वो खाओ, जिससे कोलेस्ट्रॉल भी कम होगा. पीपल हैव अ रॉन्ग नोशन घी इंक्रीजेस कोलेस्ट्रॉल. अभी ये कोलेस्ट्रॉल इंक्रीज बाय अदर फैक्टर्स, बाय गेटिंग एंग्री, by smoking, by not eating in proper time. But if you take ghee, 1 spoon, I have seen one place in Andhra, Rajamandri. People eat ghee in what you call in koli, in a small dish they eat ghee. I'm surprised. And then the chilies they eat, the moment by seeing the sabji, I'll get loose motions. That much chili, and they are lean, thin, healthy, tall, 6 feet, 6.2 feet. All the film heroes of the Bahubali and all that, they eat ghee like anything, and with the mirchi. Tell you all the mirchi, all the gram masala, they are probiotics. Don't take extra probiotics. Don't take statins. They are all there in our Indian food. People want what do you call this proteins and vitamins and all that. Moringa leaves, best one, having maximum protein. Moringa leaves, drumstick. You use drumstick. See, in South Indian sambar, they always put drumstick in that. It has so many qualities. Just go and read. Don't believe me, but go and read that. Yeah. Anything else, ma? Diet for IBS patients. Yeah. Avoid maximum fiber food. Minimize that. I was talking about that lady, Meera Ramakrishnan, 57 years. She's still with us as a patient, and now she is 80 years, troubling us too much. She says, sir, it is written in the Google, you should eat fiber food, it is good for health. Good for health for everybody, not for you. Already your intestines are so weak, so loose. Anything you fiber, you'll get loose motions. So except for heavy fiber food, other things can be taken. Mentally, you have to control them. You have seen the first patient, how she was, and how she smilingly spoke in the last video. Sir, I'm so happy. I have started controlling my anger. I'm looking at, this is what I told her. Get up in the morning, smile, sit in the bed for 2 minutes, just meditate, whichever God you want. Ram, Krishna, Hanuman, kisi ko. Then go out and look at the sky and say, ha, all these things will reduce your tension, reduce your, and it will give you a fresh day, food, early morning. So all these things are there. I think Ram Prakash ji has, anybody else? Any other question, ma'am?
Sir, someone asked in chat box, can you please suggest a balanced diet including proteins, carbs, and fibers?
Please don't go on this English diet. Whatever Indian food you eat, it has everything, whatever you need. If still there is a lack of proteins in it, it is your absorption problem. The Indian food is so healthy. उसमें दाल है, उसमें सब्जी है, उसमें गरम मसाला है, उसमें धनिया है, उसमें we have everything in that. So all the ingredients needed for a normal diet, everything is there. Only thing the Western thinking has put in our brain. Oh, what is your blood sugar? What is your BP? Today, yeah, morning, one girl, 23 years girl came and said, "Sir, my blood sugar is 120, sir, after food." I said, "What happened? It should be 110 only." Yeah, what are you talking? This is what you need to educate them. Don't bother. And if they see it is not fixed 110, it should be. It is only suggestive. It is only an average. And all these averages and all these things are calculated in St. Johns Hopkins Hospital in America, and that you are applying to India. Americans don't spend so much time in talking and all that. They spend only time in drinking, eating, everything. We have a different lifestyle. So all the parameters, don't take it for granted. Now, how many of us know really that the HB1AC, what is the normal? Yes, madam, Dr. Ruchaji, what is the normal?
Sir,
HB1AC?
it's less than 6. Matlab, it should be less than 6.
6.
Around 6, yes.
Now, right now, let me tell you, it is 8. Do you know that?
No, sir.
Blood sugar can go to 250, nothing happens. Unless there are symptoms come, don't bother.
Yeah.
This is the latest one from the American Physicians Society, which has declared, which is much more powerful than WHO and this thing. Every reading that is coming to us is controlled by drug industry to sell their drugs. Now, to be very frank with you, I was student, means for 54, 55, 55, 56 years back, blood pressure was 120 by 80. Okay. Then they reduced 110 by 70. 50% of Americans became hypertensive and everybody was put on the drugs. Bilkul mat karo. Don't go on that. Unless you have real problem, don't treat them. You can give placebo and earn money. Do, 3 placebo de do, jitna manje paisa kamao, no problem. Because doctors cannot live without patients, but patients can live healthily without doctor. Okay. Yes, sir. Anybody wants to say anything else? We have 2 more minutes. Sir, Ramarji. Yes, sir. Tell me, sir. Unmute yourself.
Thank you, Rucha, and heartful congratulations. Sir, main presentation, gastric disorder. Gastric disorder या structural change या pathological change, main cause of disease, mental, mind disorder. तो माइंड में काम बात कफ लोभ पारा, क्रोध पित नित छाती जा रहा। कहा गया है रामचरितमानस में कि सुनो तात मानस रोगा, जिनते दुख पावहि सब लोगा। मोह सकल व्याधिन कर मूला, तिनते पुनि बुझहि बहुतूला। काम बात कफ लोभ पारा, क्रोध पित नित छाती जा रहा। क्रोध आने से डाइजेस्टिव प्रॉब्लम हो जाता है, लीवर का प्रॉब्लम हो जाता है।
रामेश्वर जी, nobody understands Ramcharitmanas here except
रामचरितमानस। हाँ, तो क्रोध के कारण गैस्ट्रिक का प्रॉब्लम है। क्रोध के कारण ऐसे तो खान पियन है, यदि नित दिन खाए ताजा सब्जी, फल फूल और कंदमूला,
that's okay.
हो जाए बन जाए, हो जाए गुलसीला।
Please tell something in English. Please tell something in
very
English because many of us will not understand. This is nice. Yeah.
ठीक है सर, very thanks.
Sheila ji, yes, anything else? Dr. Sheila ji? നിങ്ങൾ മ്യൂട്ട് ചെയ്തുകൊണ്ടോ? മ്യൂട്ട് ഉണ്ട്, അൺമ്യൂട്ട് ചെയ്തു. നെക്സ്റ്റ് ഇരിക്കുന്നത് ഹോസ്റ്റ്. Unmute. Sheila ji. Unmute yourself. Unmute ji, Sheila ji, unmute.
Sir, your class was very nice, very informative.
Yeah.
Thank you, such a wonderful class.
Malayalam അറിയാ?
മലയാളം അറിയാം.
അറിയാം. അത്തമ്മ അടുത്ത സംസാരിച്ചു.
Okay.
നല്ലത് നല്ലത്.
I am the moderator of next section.
അത് മനസ്സിലായി.
Okay.
Yeah, go ahead. So nice. You can take over. My side
Okay.
over.
Please, Rucha, please conclude this English session.
Unmute.
Oh.
Unmute. Rucha ji, Dr. Rucha.
Yes, sir. Yes.
Yeah.
So thank you so much, sir. It was a wonderful session and looking forward to hear from you. And this is now almost 9:33 and it is now Malayalam session time. So over to you, ma'am. Thank you so much. Thank you so much to all of you.